many of the wellness influencers are not trained or qualified. So the information is not rigorous, it's not accurate, it's not robust. A good relationship with food reduces your risk of all food-related disorders. You know, if you...
I'll tell you what, if you finish all your broccoli, I'm going to let you have dessert. But no pudding for me because I'm on a diet. Did you grow up hearing phrases like that? And if you are a parent or carer, have you ever stopped to think about how your own relationship with food might be shaping your child's relationship with food? For a lot of young people today, the pressures around body image are relentless. And for some people, it turns into a daily struggle with food and self-worth. In this episode of The Lifestyle Prescription, we are going to be exploring how to break negative behaviours around food, how to create calmer meal times, and how to build a healthier relationship with food in general for both you and your children. My name is Rena Annobil, and my guest in the studio is Dr Anna Colton, a clinical psychologist and eating disorder specialist. And she's also the author of this really thought-provoking book called How to Talk to Children About Food. Thank you so much for joining me, Dr.
Thank
Anna.
you so much for having me. It's lovely to be here.
So, as I said in my intro, clinical psychologist, you've got over 20 years of experience.
Yep.
And before we get into food and all that kind of stuff, I just want to know, what was it that drew you to specialising in eating disorders and adolescence?
That's a really great question, and I will try and be brief because I could waffle away for far too long on that. I guess I grew up with, in school, I was in girls' school, and there was anorexia everywhere, and about 4 or 5 girls in my year actually ended up in hospital at different stages being treated for anorexia. So I was really quite aware of it. Food and weight and shape was a thing. Adolescence, I mean, I'm probably still pretty teenage. I've never grown out of it. I love teenagers. I love it. I think it's the most amazing period of life. It can feel really rubbish for many years, but knowing how the brain rewires, all the changes that go in within neurologically as well as physiologically and sexually and hormonally, it's the kind of the absolute combination, I think, adolescence, and one of the things I really liked of brain, body, psychology, social, emotional, all coming together in this melting pot, and that's really interesting. And fundamentally, I just love that age and stage, as I say, and I'm probably still quite stuck in it. So the combination of really enjoying that and a lot of the work being around eating disorders, and I do all eating disorders and always have, but I've probably done more anorexia.
Okay.
And again, that's really quite brain-based and very physiological. And I really like that kind of grazing the medical side as well as the psychology.
I agree with the thing about teenagers. I think it's a really interesting phase. And I think they get a bad rep as well. I love hanging around with teenagers. I find them fascinating.
So I think teenagers are the most degraded group in society. And it's really, if you look at what people say, oh my God, it's a gang of youths. Like, oh yes, it can look intimidating when 20 teenagers are walking down the street in hoodies, but they're probably much more intimidated and feeling much less comfortable in themselves and their bodies than anyone else. There's so much denigration that goes through the literature, that goes through the media, and it's a fantastic population of people. And it's a time of working out who you are. It's such a seminal, important few years. Who am I? Who do I want to be? How do I want to show up?
Yeah.
You know, these are really important questions. What's my identity? How do I separate? How do I individuate? Fundamental.
And we're going to come back on to teenagers and their relationship with their bodies and self-image and food as well in a bit. But I wanted to just bring our conversation onto food, which obviously it's a very simple equation. You know, we need food to live, clearly, and you've obviously put in your book how it's functional, and we need to talk to kids about food in a functional way, a factual way. It can also bring us a lot of joy, right? And cultural, so many things. But then what are some of the other emotions that are linked to food?
I mean, I should say, yes, it's functional, but it's so much more. Yeah. Or not even but, and it's so much more. You know, it is. So we must have it to survive. That's the very kind of easy, straightforward, basic. But then, as you say, it brings us joy. It brings us social connection. It brings us coming together as community. These are all the kind of the good things that that brings. It's a way of sharing. You can share your heritage, or you can share your celebration, or your milestones. You can share stories of your youth, your family, all through food across the table. You can have a joint experience. These things are so important. The flip side, of course, is that particularly today, but for the last many decades, it can become mired in shame and blame and guilt. It can be used to punish just as much as it can be used to reward. It can be used as a kind of vehicle of a communicator of emotion. And that's when things go wrong, is when food is the communication. Either it's the vehicle for power play, or it's the vehicle of I communicate my emotion, or I manage my emotion like this. And that's when things get very confused and distressing.
So in your house growing up, what were conversations around food like, and attitudes to food?
When I was growing up, very atypical, actually. My mum was a very fussy eater, very, very fussy.
Right.
My dad ate anything. My mum ate outrageously slowly. My dad ate incredibly fast.
Okay.
So, my mum had at school in her generation been made to eat school lunches that she absolutely hated, and she refused to ever make any of us eat food we didn't like. So she would make more meals. She didn't mind if not everyone ate the same thing. She was, in some ways it was slightly mad, drove my dad mad, I think. But in other ways, there wasn't the pressure that actually I often see, because she too was like, well, I don't eat all this stuff.
Right.
And she's out now.
Quite relaxed then.
From that perspective, quite relaxed. We had a big family, have a big family. That it was open house. There was a lot of big meals, a lot of entertaining through food, a lot of socialising through food. So it was the fridge was always totally overfull. That was my experience.
Okay. So these kind of attitudes towards food and how we grow up in our families, and are they, do you think, in your experience, just naturally passed on generation to generation?
That intergenerational transmission is a thing. Intergenerational, by which I mean, our ancestors, our great grandparents, kind of put their attitudes onto their children, therefore our grandparents onto our parents onto us onto our kids. And if we're not aware of what we carry, we will inadvertently pass it to our kids. It's inevitable. Yeah. It's not a choice. You have to be very aware to have a choice about, what do I want my child to grow up believing? What do I want them to feel around food? Do I want it to be something they're anxious about? And actually, I would say quite a lot of parents do want that. Not if you say, would you like your child to be anxious? They'll say, no, absolutely not. But if you say, do you want them to be really mindful of their health and know what's good and bad, and I put it in inverted commas, because I don't believe in good and bad really, but what they should eat, what they shouldn't eat, don't agree with that either. But a lot of parents will say, yes, I think that's very important. So there's a real conflict around it. So you need to know what you carry and what your baggage is with food, so that you can have choices about what you pass down to your kids.
So are there any patterns where you see families and children develop difficult relationships with food?
All the time. I mean, that's what I do for a living. So yes, all the time.
Okay.
I see that. So, for example, often, and it can come out in so many different ways. It can just be that, for whatever reason, a grandparent or a parent has been quite anxious around, their health. What must you eat for your heart? What should you do? You don't want to eat too much fat. You don't want to eat too much, too much fat, for example, because that's bad for heart health. That actually is slightly a myth that has been debunked over the last number of years. But then that is passed on. Oh, no, I don't want to eat that. Or be really careful. You can't have too much fat because it's bad for your heart. A bit like you can't have too much sugar because it's bad for your teeth. Now, in some ways, that's quite a good communication, because it's about health and it's quite factual. And yes, you do need to brush your teeth, but it can become loaded with so much more meaning. You're going to die if. You're going to die if. And you really need to pay attention. And you really, this is a very important thing, and it's got a lot of meaning what you eat. And that can create a huge amount of anxiety. It can be something like, you know, that if a parent died of a certain illness and that was related somehow to diet in some way, the fear of that can get passed down very easily, and kids can become quite anxious. It can be that there's been, you know, a history of overweight or obesity, and that's caused a lot of trauma, and parents desperately don't want their children to experience that, and therefore put quite a lot of pressure on around weight and shape with the right intentions, right? Because the bullying, the stigma, the shame, horrific.
Yeah.
But then the messages to their children are, your body size is absolutely fundamentally important to who you are, how you feel, your acceptance. And it can get very complicated. And if you've come from a background of, for example, if you've experienced food scarcity or food poverty, then that will carry on into how you relate to your children and whether they have to clear their plate, how you cope when they don't. It's really complicated. And that's one of the reasons I really like working in food, because it's this thing we have to have. But it is there are so many meanings across so many layers.
And that whole thing about cleaning your plate, I remember my dad saying that all the time, and he used to tell us stories about how when they were young they didn't have much. My mum had all these stories as well about how they didn't have much, and you know, quite sad things like, you know, her brothers were given the meat in the curry and then they just had the bones and that kind of thing. So, you know, it's really like there's a whole thing of, oh, we're so lucky to be having this, you know, we really thought that as well. In the same way that sometimes anxiety can get passed on, do you see any positive things being passed on as well? And if we want to pass on positive things to our kids around food, what might those things be?
I mean, I do see positive things passed on. I'm in a slightly skewed position, I suppose, because I work in eating disorders.
Yeah.
You know, and I work with people who struggle with food. So I spend a lot of time hearing the other side. But yes, absolutely, the joy and the celebration and everyone coming together and I really want to have, you know, birthday cake. Right? It's a really simple thing. Did you grow up with birthday cakes being a thing? That's a really positive association usually. What did your parent or your caregiver do on your birthday? And often, you know, some parents would have bought a cake, some parents would have made something absolutely glorious, and that gets transferred down. So absolutely. And I would hope that the joy gets transferred down more than the pain and the shame. I'm not sure it always does. But yes, the good stuff is passed on too. If you want to pass some of the positive associations to your children, then you really do need to model a positive association. And when I say model, it's how you behave. Or in psychology, you know, a working model is what we internalize from what we see.
Yeah.
So what is your internal working model around food? Well, if you want your kids to have a good relationship with food, you kind of need to do it. You need to show them what that looks like, not tell them. Because we learn by watching, and children particularly, the younger they are, the more they learn by watching. But teenagers will call you out. They'll say, yeah, you say that it doesn't matter, but you're not eating that.
Yeah.
And you'll be called out. It doesn't really matter what you say. It's what you do. And that's one of the really difficult things. Because for many, many of us, that puts us in a position of having to really step outside our comfort zone sometimes.
I mean, this was a wake-up call to me, you know, because I was reading some of it thinking, oh my gosh, you know, I do these things. This is something that I'm unlearning. This is such a good book, and it's very easy to read as well. You know, I think a lot of people it's gonna resonate with a lot of people, and this conversation will as well. You know, there is a lot of pressure on parents as to the health of the child, and it's from when they're born, as we know. You know, you're a mum, I'm a mum, and you work in this area, so you know, Anna. But if for example your child is overweight, obviously nobody wants that, because I don't know if it's still happening, but I remember there was a time not that long ago where your kids were weighed in school. Then you got a letter. It is
still happening.
Right, so then you get the letter through the door, your child is in bold overweight, if they're overweight, right? So then it's like, wow, oh my God, what am I supposed to be doing? What can we do though? Because then naturally you're thinking, oh my God, you know, they do eat quite a few biscuits. What am I going to do? Am I being a bad mum? Should I restrict? And I don't know, what do you advise?
Look, it is a nightmare, actually. I do think it's a nightmare. And I think it's a nightmare because I think the amount of pressure that is put on parents to take complete responsibility for their child's health and for their child's everything and for their own health and for their own is disgraceful, right? Because I think we live in a society, and we live in a society where so many of the factors that contribute to this are at play and we have no control over them. So, for example, you buy the food you can afford. You have to feed your child. That's the bottom line. And food is really expensive. And every parent does the very best that they can do. So yeah, that was one of my things in writing the book actually, is how do I say you've got to look at your own stuff without being blamey or judgy? Because I'm a mum. I've done this. Sometimes it doesn't go the way you hope, and you've tried your best and it's gone wrong. Okay, we just work with that. So I'm acutely aware, but there is so much that is out of parents' control. There's so much out of our control, and the mixed messaging is really problematic. You mustn't eat this, you mustn't eat that, but here you can get anything you want on demand, and the foods that you would like your child to eat less of, or you would like to be able to eat less of, are the cheaper foods.
Yeah.
But they're often the poorer quality foods. And I'm not talking about good and bad, because I really don't believe that, but we can talk about nutrient density. And actually, quite a lot of if you've got a parent working, shifts or nights, or they're just two jobs, it's got to be quick and easy. And often the quick and easy is poorer nutritionally. But so that's my first thing. The other thing is it is a parent's responsibility to provide the food. So the division of responsibility is you decide when you're serving the food and what you're serving, and your child decides or has responsibility for what they eat, whether they eat, how much they eat. And actually that takes a lot of pressure off, because you go, this is the food, that's it, and then you have a lovely mealtime and you're connected and you're chatting about the day, and hopefully your child eats enough. When your child doesn't eat enough, it can get quite stressful. People say to me, you talk about, and this is kind of a very long-winded answer to your question. Yes, but you talk about, helping them listen to their body, but what if they eat too much? It is possible to say no. It is possible to have boundaries and remain neutral and remain non-judgmental. You can just say, that's all there is for now. There's some fruit if you'd like it. It's about the emotional loaded meaning you give to it. When that letter comes home from school saying your child is overweight, I mean, I opted my kids out. I didn't let them be weighed at school. And I want to say to everybody watching or listening, you can do that.
Right, I didn't know that, but
yes,
that's a good point.
You can do that. I did not let it happen because I disagree with it. And it starts the conversation about weight and body size at far too young an age. And when that, the comparisons, you've got to go in and be weighed, then a letter comes home and your parent is potentially distressed. And then there are conversations about weight loss at 5 or 6, and you're being set up for a lifetime of struggle with weight and food and shape. So if you want to opt your child out, feel free to opt your child out. You can. You just say, no, I don't consent.
Okay.
When it comes home and it says that, I mean, you have a decision to make as a parent. Do you agree? Because remember, BMI is a terrible indicator. It's a very, very poor measure. It was developed as a statistical measure to assess the average white European male. That's what BMI. That's how it was developed back in the 1850s. It was not developed for health, but it got picked up by insurance companies who found it a useful way to categorize people for, insurance pricing.
Wow.
And then it got picked up as a health measure. And it is, it is really not the way to understand somebody's health, because it's literally a mathematical equation of height and weight. That's it. And it doesn't take into account any other factors than height and weight. Doesn't take muscle mass, doesn't take heritage. And, different ethnicities have different BMI scales, which is, and I could go on for ages, so I'm going to stop. But it's a very poor measure. You will know if your child is overweight. You do not need to. I just don't think you need to be told. And then you say, "Is this a problem, or is this just It's part of the ever evolving trajectory of my child's development. Is that they're about to have a growth spurt up, and their body shape will change. Or do you want to say, well, let's just slightly tweak what we do at home, but instead of making it all about food, how do you build in some more exercise? Make sure they're not bored. Make sure they're not sitting on the sofa too much. Make sure that they're running around with their friends outside. And really think about that division of responsibility. What do you want to feed them? What do you want to provide for dinner and snacks? It can be done.
I really like the fact that in this book you have pointed out that at certain points, especially for girls, there will be a gaining of fat, and it's so that you can
There
start
must
your
be.
period. Yeah, and I think that's so important. I want young girls to know that.
So do
because
I.
I don't think that they do.
They
know
don't.
That.
I don't know why they don't. It should be part of PSHE.
Yeah.
And just to clarify for everyone, that to go through puberty as a girl, you must gain not only weight, but you must gain body fat, because it is the body fat that enables the ovaries to work and that stimulates the ovaries, that allows periods to begin, that allows menstruation, that allows you to progress through a healthy puberty. It's why, for example, often the really elite gymnasts or ballet dancers get their periods really, really late, 15, 16, 17, and probably 16, 17, 18, because there isn't enough body fat. And it's not about the number on the scale, it's about the percentage of fat. It's why female bodybuilders will lose their periods when they're competing. It's why often the female marathon runners or athletes will lose their periods. There's not enough body fat. It's fundamentally important, and it comes before periods, right? Because it's the bit that stimulates the ovaries. And so it's the pre-pubertal or the early pubertal weight gain that you see in girls. That I really loathe this phase. I loathe it with all my heart. But that thing that, often when I was younger, people say, oh, lots of puppy fat. I mean, can't bear it, but that's what's being described.
Okay, that's so important. That is so important for people to keep in mind, and especially because of media. Now, yes. I grew up in the 90s and like in terms of I reached adulthood early 2000s. And around that time, the late 90s, early 2000s, being skinny was in fashion. Everybody wanted to look like Kate Moss, whether we were built like that or not, we aspired to be that. It's happening again. So these cycles obviously come around again. That's what's happening. Now, and this goes against exactly what you're saying. The acceptance of we are going to gain fat as girls at this time, it is normal. Mm-hmm. So now there is the desire to be thin. Now, how do you see this? How much do you see this affecting young people? Social media, all these trends.
It's absolutely massive. It's a real problem. With the explosion of GLP-1s in particular, the weight loss jabs, the whole narrative is shifting back to thin is best. And by the way, there's a quick jab, and probably by the summer this year there'll be a tablet you can pop that's a GLP-1. And because that bit of the industry isn't regulated, they're being misused everywhere.
Because obviously they are great for some people that need them, right? So it's a misuse that we're talking about here.
Don't get me wrong. For the right people with the medical need, they are a really important medication tool. They are a tool, even for the right people, in a whole package of care, even for those people who need them. But what's happening is, to get them on the NHS is incredibly difficult because there are many criteria you have to meet. Yeah. Right? Only 5% of GLP-1 users in this country are prescribed by the NHS. 95% are self-funding. Don't know if that's a statistic you know.
No, it's not.
95% are buying them themselves.
Right.
Now, I think that's shocking. I think that's really damaging. And even if some of that 95% would meet many of the criteria, but not just every one, so some of that 95%, even if it's 50-50, there's 50%, and it's not 50-50, it's not that many. But even if we said it's 50-50, 50% of people taking GLP-1s do not medically need them. They want them for aesthetic purposes.
Yeah. And we're seeing it now, Anna, aren't we?
Everywhere.
The Met Gala recently.
I mean, the Met Gala, what about...
People are shrinking like anything, right?
Yeah, but you notice it in your social circle.
Yeah.
I mean, we don't need the Met Gala. We
Yes,
see it at the school
absolutely.
gate. We see it everywhere. And it's a massive, massive problem because the messaging, remember, messaging is not just what we say. It really is actually what we say is the least important part of our messaging often. It's what we see happening. And so the messaging that's going out is, yeah, sure, you can be happy with your body, but I'm not happy with mine, so I'm just going to shrink it. No, and actually this is really desirable. I mean, there's a whole female bit, where, you know, if you look back through time, you've got, you can take one celebrity and you'll see, oh my God, put on so much weight. What does she think she's doing? Then there's been weight loss. Oh my God, so skinny, looks awful. Then changed her size again. Oh my God, what is this? There's nothing that we can do right. So there is a female thing there, and don't want to say the patriarchal, but the patriarchal.
The patriarchal, yeah. I do think about
influence.
How to, obviously, yeah. I think about how to counteract this in my own life, because I've got 3 girls, and I've really had to address my own relationship with my body, just because I'm trying to counteract all of that noise for them. And skinny legend is a compliment now, you know.
Skinny legend is absolutely a compliment.
Oh my God, you're such a skinny legend. And it's like, I don't care if it's a joke or whatever it is, that association with skinny as a positive thing, it just really, I don't know, it makes my skin crawl.
I agree. And even if it is a joke, the joke has meaning.
Yeah.
And that's the point. The meaning is skinny good.
Yeah,
right.
Exactly.
And we are seeing that. And so however much we say it, the issue is there. On social media, it's everywhere. I mean, there are people pushing GLP-1s, and it's not only about GLP-1, so I will get off that, but people are pushing GLP-1s to say it's going to make your health better. And that's now being, you know, wellness. It's all almost being put into the wellness silo. And it's not a wellness tool. They are not a wellness tool. They are a potent medication. But when they become branded as a wellness tool, suddenly it's, well, if I just want to feel a bit better, I just, you know, it's healthy. No, it's not. And so there's a huge educational piece, but there is a real responsibility, I think, on parents, on anybody who is in contact with young people, with children and teens, to counteract the messaging, because GLP-1s have gone straight into the diet culture trope, which is thin is good, thin is morally better. That's a real important point. It's about morality and worth, and your value in the world. You are a more valuable person. You're more worthy of success or love or attention or a partner or whatever it may be. If you are slimmer, thinner. It's that, you know, the praising, or, you know, you look after yourself. The assumption that if you're a certain body size, you look after yourself, and if you're in a larger body, you inherently don't. If you're in a larger body, you don't care about your health. You're lazy. You're not as bright. These things are all wrong, but that's what diet culture does. And at the moment, diet culture is booming.
Yes, it is.
More than ever.
I mean, in my conversations with people in this room, you know, I talk about the wellness industry and just call people out, really. The fact that the wellness industry, I love the fact that we have all this information now about what is good for us, right? Because when I was growing up, there wasn't that much information. And if there was, my parents didn't actually care that much. So I was eating Findus crispy pancakes and drinking Sunny Delight to my heart's content, right? With joyful abandon, okay? So I wouldn't do that to my kids because I know better. It's not the greatest thing for them to put in their body. But do you think that too much information is available now and it's detrimental to us?
Well, I think too much information is available and it's detrimental. But I also think that many of the wellness influencers are not trained or qualified. So the information is not rigorous, it's not accurate, it's not robust. You will have seen this week, possibly on the news, you know, the sleep fairy who has been, you know, caught out as having no training and actually promoting something that increases cot death, the chances of cot death. It's shocking, but not surprising. You know, and that's happening across wellness, across psychology. Anyone can call themselves a sleep consultant or a maternity nurse. A nurse is not a protected title. Psychologist is not a protected title. Anyone can call themselves a psychologist. Anyone can call themselves a therapist.
That's actually quite scary, to be honest.
Terrifying.
I mean, with the ease of what it takes to film yourself on your phone and put that information out there,
right?
And the lack of knowledge that people have, it's scary that these things are being put out into the world and people are watching them. Because that sleep fairy lady had a lot of followers.
Right. Exactly. And it's across the board.
Yeah.
And we need to be helping our kids, and we need to be really critically curious of who is this person I'm following? What do they actually know? And I'm not dissing lived experience. Is it lived experience? Or is there also an evidence base behind it? Because lived experience is totally valid and valuable and important. But lived experience is a sample size of one. And science is a sample size of thousands, tens of thousands, hundreds of thousands, millions. And that's a really, really important difference. And so we need to be rigorous ourselves in who we're following and what is their training, what are their qualifications, what is their knowledge actually, and we need to be teaching our young people to do the same.
Yeah. So when it comes to influencers and influencers who are having a negative impact on our kids and even ourselves, I know that you've kind of given some approaches in this book, but what do you think good ways are to counteract all of that?
I think you have to start young. I know it sounds awful, but I think, the moment that you see diet culture coming into your home via school or via other friends, or my friend's mummy says that sugar is really bad for you, you need to say, well, actually, that's not what we believe here, and our view is that there's place for everything.
Okay.
For example, so you counteract it, you call it out when it comes home. The kids say, "Oh, I've seen this at school." You say, "Oh, well, that's a diet culture belief, and this is what you have to go really heavy on it, but you have to challenge it, because otherwise, what you're doing is you're becoming complicit in the acceptance of it." And I, for one, don't think we should be complicit in the acceptance that diet culture is a good thing. I really don't. So with influencers, you say to your kids, who is she? Why do you like her or him? Why are you following? Be curious, not judgmental or critical, because they'll just tell you to sod off and they'll shut down and they'll, that'll be the end of your conversation. But oh my gosh, so tell me, who is this person? What do you like about them? What is it they do? Show me. Watch it with them, and then little bit by little bit you can say, shall we have a look? What's their background?
Yeah.
And help them to learn to critically think in a kind of collaborative way, but you have to be on it and really say these are the harms that can be caused if you go down this path. Fitspo is another one, boys or girls, there's more of an issue, I think, with teenage boys at the moment really wanting to bulk.
Protein.
There's protein.
The pressure to eat protein, even for me as a grown woman, is insane at the moment.
Yeah, the pressure to eat protein, the pressure to bulk, though, so to go to the gym and get muscles. But actually, puberty, boys' puberty is 2 years after girls' puberty on average. So, where a girl might go in between 9 and 11 at the very beginning, boys are 11 to 13. Often boys don't go through puberty until 15, 16, sometimes a bit earlier. Their body isn't ready to be bulking. It needs to be finishing that development. And yes, go to the gym and have a lovely social time and enjoy it and enjoy exercise and make movement and exercise a part of your life. So good. Big fan of that. But the desire to sculpt your body in a certain way is, again, it's diet culture through a different lens. And we have to be saying, what is this? Why are we signing up to this? Your body is just doing what your body needs to do at the moment. There is a real importance to movement and exercise, but sculpting?
So, like a lot of us as parents, we are on our own health journey. And, some of us are having these wake-up calls where, we're being told, you're overweight, you need to lose weight. Great, we should be looking after ourselves. But if then we need to adapt our eating habits at home, we might need to be calorie counting and that kind of thing, we've been told.
Every fibre of my body is rebelling against that phrase. I'm like, no one needs the calorie count.
I know, I saw your face. And also in the book, there's when you wrote the bit about diet culture. So I start that chapter thinking, this doesn't affect me, diet culture, I'm not on a diet. And then reading that chapter, it was like, wow, this is how I have been affected by diet culture over the years. Calorie counting, a lot of people are doing it now. A lot of people are weighing food. Food is now a mathematical equation. A meal is a mathematical equation for many, many people. Okay, so I know what you're going to say. Absolutely not.
Look, that's the problem with this. There is nuance, and even I know that if there's genuinely a problem and for your health, you need to change what you're eating and you need to tweak it, you're going to need to do that. I'm not going to say, well, just throw all abandon to the wind and live on Pringles. That's a ridiculous idea. But we know that 95% of diets fail because they put you into restriction. And when you get into restriction, what happens is you start to think about everything you can't eat and your cravings for those foods go up. And you develop the kind of the scarcity mindset, the deprivation mindset, where you feel you're being deprived. So it's actually a really difficult thing. Calorie counting, unless you're going to include all foods and say all foods are allowed, I'm just going to count the calories. I don't agree with that either, because counting calories means that you don't listen to your body at all. You use an outside equation to regulate how you're feeling. And it disconnects you from your body, and it leads actually to a much greater risk of binging because you're hungrier, and the number one cause of binging is hunger. So, I don't want to talk really terribly much about how to lose weight, because that's so not what I am and not what I'm really advocating at all. But if you do need to adapt your eating behaviour for your health, you can do that within the context of your family in front of your children. It's how you talk about it and what behaviours you show. If you're always standing there measuring, if you're diabetic, you might have to weigh and measure. That's very easy. I'm diabetic and I'm not allowed, this is the maximum amount of carbohydrate I'm allowed, and therefore I measure it. Fine, that's fine. It's very clear. There's just nothing wrong with that at all. And you explain it in terms of the facts of the condition. Mm-hmm. Fine. It's like allergies. Fine. It's a medical thing. It's when you say, well, I'm getting fat and I don't want to get fat, so I now need to weigh and measure because I mustn't eat more fat and I mustn't eat more protein because my body is going to look a certain way, or because I'm not going to be so acceptable. That's the issue. You can actually do it without talking. You can just, have a smaller portion that isn't tiny, but it's the same food as everyone else is eating, the same food that you'd put on the table for your family, and you sit and enjoy it and you share mealtimes together, and it's not actually a thing. And that's the point. Let's not make it the thing. Mealtimes need to be about connection and sharing and bonding and talking about whatever the hell you want to talk about, whether it's your day or whether it's something ridiculous. It doesn't really matter. It's about being at the table together and coming together at the table. And if that is the main purpose of a mealtime, and I know that sounds strange because everyone goes, the main purpose of a mealtime is to eat the meal. But actually, if you're thinking about how you help kids eat a meal and develop a good relationship with food and try new foods, if they feel really relaxed and comfortable, if they enjoy being there, if they associate it with pleasure and fun, they're more likely to want to come back to the table. They're more likely to stay at the table for longer. They will watch you eating all sorts of foods that they may not like. Bit by bit, they'll get there.
And is that the advice that you would give to people who have kids that are picky eaters?
Yes. In a nutshell, yes. There are all sorts of things that you might need to do with your picky eater. But yes, You might need to separate foods for a picky eater if there's some sensory stuff where they don't like their foods touching. You can separate them. So the advice is always, and this goes back to the division of responsibility again. You put it on the table. Ideally, you put lots of different dishes on the table. So you might put the peas in one bowl and the pasta in another bowl, and the potatoes in another, and the salad in another, and the meatballs in another, and the sauce in another, right? And then you can all serve yourself from the bowls on the table. Now, what's brilliant about that is kids see different people taking different foods, combining it on their plates or not. They learn to serve themselves, so there's motor skills advanced. They learn to kind of assess what they might want to eat for their hunger. They have responsibility. It gives a sense of autonomy, and they're much more likely just to kind of try something than if they're presented with a plate of food that's all put together and it causes them anxiety.
Yeah. I mean, that sounds like a wonderful way to have a family meal anyway, and it's just to be really relaxed. So that term healthy eating, though, from a psychology perspective, what does that mean to you, healthy eating?
For me, that is diet culture trope, because healthy is code for good. So, I don't mind a healthy, balanced diet. I think that's different, because that's talking about balance across a whole intake. Mm-hmm. Healthy eating, what is that? So I would rather we talk about, a healthy, balanced diet than healthy eating. But I know what I think people mean, which is usually, lots of fruit and veg, lots of different coloured fruit and veg, not too much of this, that and the other. But I think it can become prescriptive and quite obsessive very quickly. And I think it morphs into good and bad foods, right and wrong ways to eat in the blink of an eye. And that's really the opposite of what I would advocate and what I think is actually healthy for our overall relationship with food. Because ultimately, if you know that you can trust your body, that some days you will go to a birthday or you'll go out for a meal and you might eat a little bit more, but the next day you might eat a little bit less. And actually you realise that nutrition is over months and years, not meal specific. And you realise that actually it all just regulates, and you can regulate, and you don't feel deprived, and you don't deprive yourself, and you don't end up binging, and you don't end up starving. That's what you want to be.
I mean, it sounds like we have forgotten to listen to our bodies.
Totally. It's not even that we've forgotten, we are taught not to.
But some parents might be watching or listening to this, and even people who aren't parents, and think, well, if I listen to my body, or if I let my kids make up their own mind about things and don't say things like finish all your broccoli before you can have dessert, then they're just going to go straight to eating biscuits, and that's going to be their dinner, and they won't be interested in anything else. And you want them to have a balance.
Depending on the age of the kids, you don't have to give them biscuits. That's division of responsibility. Why are you giving them biscuits for dinner? You don't need to do that.
If they're in the house, if you have things like that in the house, or is that the thing? Don't have them in the house.
Well, it's not a do or a don't. The thing is, you have responsibility as a parent for what you buy and what you bring into your home. Your child doesn't go to the supermarket and do the shopping. Your child doesn't sit online and order it in. That's you. So it really depends. What do you want to bring into your home? Now, in my house, there is literally everything pretty much. So I don't say don't have it in, but I do say you can't expect to have all those foods in and for your child not to want to eat them sometimes. So if you have Weetabix and Cocoa Pops and porridge oats in your cupboard, your children will sometimes want to eat the Cocoa Pops. If you don't want to eat the Cocoa Pops, don't buy the Cocoa Pops. So,
Sure.
Be mindful of what you bring in. And remember, you have responsibility for what is offered at meals. And yes, you do want them to eat the broccoli, but you don't want the broccoli to become, when you started the intro with, eat your broccoli, we want them to know and to eat it. But if it becomes eat your broccoli and then you get your ice cream, what you've done immediately is set up a food hierarchy where broccoli is less desirable than ice cream. That's literally the opposite to what you want to do. You want them to go, I really like my broccoli. So then broccoli is just a part and a parcel of a meal, and you sit there and you go, isn't this delicious? And maybe sometimes it has some seasoning on it and maybe it doesn't, and it's just a thing. And sometimes they'll eat more broccoli and sometimes they really won't like it. Like, we do all have preferences, and that is okay. And it's, is there enough veg that they like? Okay, great. And is it over the course of a day? Great. So I think we can get really caught up in this, and we need to broaden our perspectives a little bit to whole days or whole weeks of intake, and not get hung up on certain bits of food, and realise that we often set them up not to like it. They are not born. When you think about weaning your kids, I imagine they didn't spit out all the veg when you first offered it to them and only eat the fruit. That's just not what happens, is it? They like some, they don't like other. One of mine has never, ever liked banana, to a completely visceral thing. It's been from weaning. Never, ever, still doesn't. And never, I think, will. Okay, that's a really strong preference, and that's okay. We all have that. So I think we set them up often not to like the veg or the food that we are keen they eat.
Weirdly, my 3 kids all love broccoli. It's just me that doesn't like it, weirdly.
So my kids, again, love broccoli. And actually, I'm lucky. Lots of fruit and veg goes down.
That's good.
But,
if someone is worried about a loved one in their family, when it comes to issues with eating, what are some of the warning signs? When should we be worried about someone?
If you're worried, that's a warning sign, I think. The fact that you're worried, you've noticed something. You might want to sit down and go, what is it I've noticed? What is it that's making me worried? But if you're worried, there's a warning sign. The classic warning signs are noticing that someone is cutting out food groups, or refusing, never having dessert. talking about food in a way that actually, and this is on the restrictive side, we'll go to the other side too, talking about, food in a way where it is very highly good and bad, where there's kind of fear around food, because you really don't want fear around food. They're very frightened if they eat something, that something bad will happen to them or their body. Or if you notice food disappearing, like whole packets of something or loaves of bread disappearing in your cupboards, if people disappear to the toilet after every single meal without failure, and they're there for quite a long time, you might want to be curious what's going on. Sometimes you can see bits of vomit in the toilet bowl. Sometimes you can notice they're not looking well. Either way, whatever way, they're not looking well. If there's a lot of distress around food and eating, these are all signs. A lack of periods. If periods start to become, if you've got a daughter and periods start to become lighter and you've noticed some weight loss, as I say, periods stop when we lose too much weight. So a period is a really good indicator with weight loss. If someone is gaining an enormous amount of weight at a speed that is extraordinary, then that's a warning sign. What's happening. If someone is using food to manage their feelings, to a great degree, again, but you'll know.
What is the best way to broach that subject with somebody, and the first point of call when it comes to getting help? GP.
Always go to your GP. Eating disorder services in this country now it's really, really difficult. But go to your GP. Even if only to get baseline bloods and measurements, but you want those baseline measurements. The best way to approach someone really depends on who that someone is. But again, it's being curious. Is everything, you don't quite seem yourself. Are you all right? What's going on? I'm concerned. Do it from a place of compassion and concern. And how much you actually articulate what you've noticed. But you can just say, look, I've really noticed that you're seeming quite lethargic. You're looking a bit pale. You don't seem yourself. Or I've noticed that, you seem quite anxious around food or at meal times, and you seem to be cutting out food groups. What's happening here? Whatever it may be, you can very gently say, just make an observation and check in.
Okay. And there's loads of good places to go for support that you put in your book as well.
Loads in my book. There's loads, literally all of this in my book. How to have difficult conversations, what you can say. Because one of the things I'm often asked is, how do you say no and remain non-judgmental and neutral? And there's loads of that in there, That's all there is for now. There'll be more tomorrow. That's no. No, we're not having any more. No, we're not having ice cream today. No, there's no cake today. There'll be some later in the week, but I've got this if you're still hungry.
Okay.
It's okay to say no. And it's okay to say yes. It's how. The whole thing is about how you say what you say.
And if there's one piece of advice that you could give to parents raising children today in this confusing world, what would that be?
Try not to listen to all of the noise and focus on helping your kids to listen to their bodies and enjoy being at the table. Okay. And relax around the wrongs and the rights and the goods and the bads, because actually that's what gets you in trouble. Probably that briefer nugget is quite hard to do, but yes, everything we've really talked about.
Yeah. This has been such an insightful conversation, very thought-provoking. Thank you so much for coming in. And of course, your book is available to anyone who wants to learn more about the things that we have spoken about. We usually end with a lifestyle prescription on this podcast, as it's called the lifestyle prescription. So I just wanted to ask you, is there a lifestyle prescription that you want to share with listeners and viewers, something, however big or small, that you have started doing that has made a difference to your own well-being?
Finding more joy in life and doing things that bring you pleasure. For me, that is probably, for me, there'd be dancing will be in there somewhere, because I just love it. I'm not very good, but I love it. And with food, find the joy in food. Where there's too much noise, there's too much right and wrong and shoulds and oughts. So just do one thing a day that is joyful around food.
Yeah. Finding joy. Yeah,
Finding
we
joy.
need more of that. We need more of that for sure.
Yeah.
So thank you so much, Dr. Anna.
Thank you so much for having me. I've really enjoyed it.
And thank you so much for watching. Thank you so much for listening. Please do share this episode with someone that you think might benefit from watching it. And please do share, like, and subscribe to the Lifestyle Prescription on Pharmacy Planet. As always, I'll catch you on the next one.